Welcome to the Dental Billing Academy podcast, powered by eAssist Dental Solutions. Hello, dental billers. Welcome to another episode of the Dental Billing Academy podcast, powered by eAssist Dental Solutions. This episode, I want to talk about effective and efficient morning huddles. And I want to give you 4 ways to take all of the tricky, sticky out of your daily dental grind. So you're already super busy in your everyday dental duties in the office. So I want to deep dive into how to help make those more manageable, make the flow of your day easier for the entire team. And it starts with setting aside time in the morning. So, do you set aside time in the morning? I feel like I can hear a certain percentage of you all rolling your eyes when you hear the term morning huddle. It either you haven't had a very good experience with it, you have not found the best ways to make it efficient and effective for your team, so you feel it's a waste of time. The things that you do go over maybe are not getting carried through the rest of the day, so it's really not effective at all. And so that's what I want to kind of go over today. Because while it sounds easy to set aside time in the morning to meet as a team to go over the patients coming in and prepare for your daily workload, effectively and efficiently utilizing this morning huddle time has proven to be very tricky, even for the most savvy of dental offices that have just the smoothest, what seems like the smoothest operations. It can be very tricky to figure out really the best use of the morning huddle and how it can really efficiently help the entire dental practice to succeed. So let's talk about what an effective morning huddle includes. It definitely includes discussing pertinent patient information that the entire team needs in order to provide the best patient experience. So the entire team does need to participate and really actively listen, make notes on a route slip or a schedule or a notebook or whatever your practice management software allows for printing off this information. If it gives you an efficient one paper document that you can print off per patient, that has all of the information we're getting ready to go over, that's fantastic. You can make notes on that. If it doesn't, then again, using a printed off copy of the schedule or using a notebook that's just dedicated to making these notes for the patients on that schedule. You could even find a calendar template somewhere on Google probably, or sometimes there are printers that will have a blank calendar template that you could print off and use that for making some notes, and have a box for each patient. You can get really creative with it, and you can really just kind of tailor it to what works best for you and your team, because every team is different. And so this is going to be, while what I'm going to go over is kind of, my best practices for morning huddles, it is going to be different for every office. So you definitely want to take this information and you want to tailor it for your specific team. Ultimately, effective morning huddles secure the success of the dental practice. So it is really important that you do set aside time in the morning for preparation of the day, no matter what it looks like. So one of the very important things that you want to make sure that you go over in a morning huddle is the patient's insurance information and their treatment plan. Things that in a patient's insurance plan that you want to go over is all of the insurance information, such as their maximum that's been used, their remaining benefits, if their deductible has been met, and things like that. And you want to review this for accuracy. There are a lot of instances where this information is put in incorrectly to the practice management software. And so, if that patient's insurance is not verified and there's not an eligibility check, then that claim is getting sent out with incorrect information and will not get paid. So, you definitely want to verify the patient's insurance before their appointment, whether that's a full breakdown or an eligibility check based on what type of appointment they have. Because insurance denials due to the incorrect insurance information are definitely the mother of all lost profits for a dental practice. And you don't want to create more work for yourself on the back end by following up on claims 14, 30, 60, 90 days later that could have been prevented and paid very timely if the correct insurance had been verified and attached to that claim. The second thing to go over in a morning huddle that's very important is the patient's treatment and any outstanding claims. So, obviously, you want to talk about what is scheduled that day for the patient, what they're going to be doing when they come into the practice that day. But also, what is unscheduled? What do they have left on their treatment plan to schedule back for? And this directly ties into the number one that we just went over of their insurance breakdown and seeing how much benefits they have remaining. While we don't want insurance to ever dictate what treatment the patient has done, it does help to have that conversation and have it go a little bit smoother with the patient by saying, hey, you still have $500 worth of your insurance benefits to use, and you have two more fillings to take care of. So your portion will be X, Y, and Z. You also want to look if there are any outstanding claims for that patient. Again, some of these one-page documents from your practice management software may show all of this information in one consolidated area, and that's fantastic. If not, you will want to go into that patient's chart and see if they have any outstanding claims. Um, and then just kind of expanding on that, obviously you want to pull a full aging report for all of your outstanding over 30-day claims and work on getting all of those resolved. But you definitely want to make sure that the patients coming in, that those claims, that's a quick thing that you can do is look into their ledger and just make sure that none of their claims have aged over 30 days. That's a definite red flag immediately. If you have a claim for a patient that has aged past 30 days and not paid yet, that there is something wrong. And you may not have collected the full amount of the copay from the patient, or what you're getting ready to collect that day may not be accurate because the previous claims have not paid. So it's very important to follow up on those outstanding claims and reconcile them as soon as possible. And on a side note, carving out time in the day to reconcile outstanding insurance claims can definitely be really difficult, especially if you're in a really busy practice. You have to utilize all of the time management skills that you possibly can. And whether it's dedicating a certain time frame out of a day every week to work claims, or having a dedicated team member to do that, or you outsource that, you definitely want to make sure that you fit that into your already very busy day, um, so that none of these go a long period of time without getting paid, that you continue to bring that revenue into the practice and keep that money coming in.
This podcast is sponsored by eAssist Dental Solutions. eAssist helps dentists collect 100% of what dentists are owed by insurance companies. Their dental billing experts work with dentists and their teams to ensure the claim submission process is smooth and that dentists and their staff can focus on patient care. If you or someone you know is in need of assistance with the dental billing process, call 1-844 eAssist or visit dentalbilling.com to find out more.
Obviously, a big piece of information to go over in the morning is patient account balances and payments. And every front desk dental biller everywhere will say that this is very important information to go over in the morning huddle to alert them to which patients need to stop at the front counter and pay their balances before leaving. However, it is only helpful if it is accurate. So, first you want to look if to see if the patient has an outstanding balance, but then has it been verified as accurate? And what I mean by that is the balance needs to be verified and documented that the line item posting has been done, all of the debit or credit PPO adjustments per the EOB have been made, and that the EOB is on file for you to have as documentation that the patient's balance is accurate based on what the insurance has said their patient portion for that visit should be. And then, of course, you want to send statements regularly. So, and you want to document those. So, if you have a patient come in for a visit that you see in your practice management software, you have noted that they have been sent two statements and you've already given them a call trying to reconcile their outstanding account balance. That is definitely important information. Those patients really need to stop at the front desk and be handed off by the clinical team before leaving the practice because that is money outstanding to the doctor that he or she is rightfully owed. And so, obviously, having a financial discussion with a patient is difficult, but having it's and I say difficult. It's a little bit stressful, right? Nobody loves talking about money with patients. I don't know. I've never spoken to anyone that has said that that is their favorite thing. Even those that are the most knowledgeable and the most savvy with it, it's not ever their favorite thing to do. But it definitely gets a lot harder if you're speaking to a patient about an incorrect balance. And if you send a statement or you try to collect on an incorrect balance from a patient, you really cause the patient to distrust the competence of the office and, even worse, the integrity. So you definitely want to verify that the patient balances are correct before asking that patient for any copay or sending them a statement. And then the last thing to go over in the morning huddle is patient continuing care and scheduling. And so we're all very familiar with this. Looking to see is the patient scheduled for a recare visit? But then also, more importantly, do you have a plan in place for patients when they cancel their continuing care appointments? A lot of times, without having a standard operating procedure for recall, running that report in your practice management software, or if that report is for whatever reason not available, that you do track the patients that need to come back for their appointments. Because if you don't, then a large percentage of your patients may be slipping through the cracks, which means lost revenue for the office. You want to maintain your existing patient base and grow from it. You don't ever want it to go down, or you're adding new patients, but you're consistently losing your regular patients. And so you're taking one step forward and two steps backwards. So you definitely want to make sure that you have a standard operating procedure or a plan for if the patient cancels their continuing care appointment, how you are going to reach back out to them. If they don't schedule immediately on the phone with you, how you reach back out to them to get them scheduled, and the frequency in which you do that. You definitely want to communicate to the clinical team this information as well, so they can help you to get the patient scheduled back. There's a lot of teams that the hygienist goes ahead and schedules the recare appointment before the patient leaves the chair, or the dental assistant will check to make sure that they're scheduled for their next cleaning appointment before they are finished with the doctor's treatment. So, definitely lean on your clinical team. And that's why this is really important information to communicate in the morning huddle, because it really takes the whole team to make sure that this whole flow of patient information and um, giving the patient really great care, it takes the whole team at different points of the appointment. And so they can help you out with making sure that those appointments are scheduled. So obviously patients are the number one priority in a practice. We all know that. And, the dental day is going to start whether you're prepared or not. You've got outstanding claims to work, you've got payments to post, you've got claims to send, you have patients to schedule, you have patients walking in the door, you have patient statements to send, you have lots of other fires to put out and, um, different battles, chaos coordinating, just however you want to call it. You've got all of this going on every day, and it's going to happen whether you are prepared for it or not. So, my advice to you is to be prepared because the morning huddle helps the dental team to really give patients excellent comprehensive care. And that's what patients want. They want that excellent patient care. That's what keeps patients coming back. That's what keeps them trusting your office. And what gets great reviews on Google or word of mouth referrals is just that excellent comprehensive care. So when patients walk in and they feel like you truly care because you are following up on their unscheduled treatment and their recare appointment and making sure that's scheduled, that you have verified their balance and made sure it was accurate before discussing that with them, that you verified their insurance. Just all of these little details really make a difference to patients because they feel like you care and you have done your due diligence to make sure that they are having a great appointment. And that also, on top of that, what you're doing is you're doing your due diligence to ensure that the practice is succeeding and growing. So it is a twofold purpose to the morning huddle: patients first, and then just added benefits to the office and the office's revenue cycle. So I hope this was really, really helpful. Um, Definitely reach out and email me what your best practices are in your office. Maybe if you do something a little bit different or you've thought outside of the box for your morning huddle, I would love to hear about it. So email me at podcast@eassist.me, and maybe you'll get featured on a episode if you have a great out of the box idea that others could maybe learn from and would really love to implement in their offices for a morning huddle to make them effective and efficient. We want to hear about it. Thanks, dental billers. We'll see you next time. Click subscribe now to never miss an episode, and find us on Facebook to expand your network.